despite people in the 18 to 34 age group turning up in their numbers for vaccines, a study by the Center for Social Change at the University of Johannesburg and the Human Sciences Research Council research reveals that there is less interest among this cohort. However, the Health Minister, Dr Joe Phaahla, has lauded the 18-plus group for registering in large numbers for the vaccine. Now, for more on this story, I'm joined by Professor Carin Runciman, who is the Center for Social Change Director at the University of Johannesburg. Prof, a pleasure to have you on the program this afternoon. Now, the uptake of vaccinations in the 18 to 34-year-old cohort is seen as having the potential of changing the country's COVID-19 trajectory. But it seems that not all young people are keen to take the jab. Explain to us why.
Yes, thanks very much. For the findings from round 4 of the UJHSRC COVID-19 democracy survey show that while if we look at adults overall, 72% are willing to take a COVID-19 vaccine, when we look at that 18 to 34-year-old, we find that the acceptance rate is much lower. It's about 55%. So that's quite a big gap between that age cohort and older age cohorts. The main reasons that seem to be coming from young people are concerns about side effects and the effectiveness of the vaccine. Now, in many ways, this is not particularly distinctive from other age cohorts who might also have some hesitancy. But I think what's at play with some of this younger cohort is a sense of that they can afford to wait and see, that they're perhaps not as much at risk of COVID-19 as older people, and therefore they can delay in the uptake of the vaccination. So I think it's really important that public health messaging both targets any concerns around side effects and the effectiveness of the vaccine, but also stresses why it's really important for young people to vaccinate, even though there is the possibility that they may not be as badly affected as older people, but there is still a risk involved.
Now, apart from the issue of side effects being raised, at least in my view, there have also been concerns that have been raised by young people regarding their own religious views and religious statements that are made by some leaders. Has your research also picked up on this?
What we find in our research is that any explanations around hesitancy that are related to religious objections are very few indeed. In fact, in our data, it's only about 2%. And that's the same for conspiracy theories. And even rumours and kind of misinformation on social media only accounts for 5% of explanations for hesitancy. So while it's important to counter misinformation, what this really shows is that largely people have rational and legitimate concerns about a vaccine that has obviously been developed in a very quick time. There are reasons for that, and I think if we're able to popularise information around how we have been able to develop the vaccines so quickly, it will help to allay some fears amongst people who are just slightly concerned. And again, I think this makes a lot of sense. For most people, this is maybe the first time they're making a decision about vaccination. Most of us are vaccinated as children when either our parents or other caregivers make that decision on our behalf. So again, I think this is a very rational thing just to have concerns about. But what's really promising is that most of these current concerns are things that we can address.
Now, as mentioned in my intro, the vaccination cohort opened on Friday with numbers or throngs of young people streaming to vaccination sites across the country. Now, in your observation, what needs to be done to drive more young people to get vaccinated, or what kind of message needs to be brought forward?
What comes out of our findings quite clearly is what we want to do, as well as convert that high acceptance rate amongst the adult population overall into actually getting vaccinated. That's critical. It's okay to say in a survey that you want to take a vaccine, but what we really want to see is people actually taking the vaccine. And this is where our findings suggest important things around access. So, for instance, if you have a car, you're much more likely to have been vaccinated if you don't, because it's obviously much easier for you to travel to a vaccination site. So I think what this really places the stress on is the importance on increasing access to vaccination. And I think this is where, for instance, if we look at what Limpopo has been doing, with mobile vaccination sites, engaging traditional leaders, community healthcare workers, and really making sure that vaccines get to the people rather than expecting people to get to the vaccines. And I think that really will be critical in making sure that that acceptance rate actually converts into a vaccination rate.
Now, Prof, the National Health Department opted to open vaccination for the group earlier than expected because of the low vaccine take-up in other age groups. Now, what lessons can be learned through that experience? Because vaccines were available, but it seems that now interest is waning.
Yeah, absolutely. And I think probably what we will see is what we have seen with the other age cohorts, that there is a couple of weeks where there, those that are able and willing to get vaccinated will go out in numbers to do that. But after that sort of initial wave of people who are particularly active and have the means to be able to get themselves to a vaccination site drops off, we will probably again see some of the pictures that we did see of kind of empty vaccination sites. But I think this really does put the stress on the mobile vaccination sites, which I think we're beginning to see more and more of. And I think that's what will become really, really critical.
Now, there's also been messaging coming from the rest of the world that other countries, especially more developed countries, have gone past the worst when it comes to this COVID-19 pandemic, and the vaccination has actually assisted in this regard. What lessons can be learned from that experience?
Yeah, I mean, the international experience of countries with high vaccination rates shows that although it doesn't stop the virus 100%, and I think that's obviously really important to still communicate clearly to people, that the vaccine is not a cure, it's a preventative measure that will, first of all, hopefully prevent you from contracting COVID, but if it doesn't, it should hopefully make sure that you have relatively mild symptoms and do not require hospitalization. And what we see again internationally in countries with a high vaccination rate is that those that are unfortunately ending up in intensive care are the unvaccinated. And I think this demonstrates that even while we have a vaccination program, COVID is still a very serious illness, and that's why it's really important that as much of the population as possible gets vaccinated.
Well, Prof, thank you very much for your time. That was Professor Carin Runciman, who's the director at the Center for Social Change at the University of Johannesburg.